Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery digestive system part 3. In the current session, we will be focusing on the CPTs 42700 to 43135. First of all, coming to the next topic of digestive system, that is pharynx, adenoids and tonsils. If you see, the pharynx, adenoids and tonsils are divided into incision, excision and destruction, repair and other procedures. The CPT range for incision is 42700 to 42725, and for excision and destruction it is 42800 to 42894, and for repair it is 42900 to 42953. And finally, for other procedures, the CPT range is 42955 to 42999. Coming to incision, the first CPT is 42700. It deals with incision and drainage of abscess peritonsillar. For a peritonsillar abscess, you need to code 42700. Incision and drainage of peritonsillar abscess. If the abscess is retropharyngeal or parapharyngeal, intraoral approach. For intraoral approach, for the incision and drainage of retropharyngeal or parapharyngeal abscess intraoral approach, the CPT is 42720. And for incision and drainage of retropharyngeal or parapharyngeal abscess external approach, the CPT is 42725. Next, coming to excision and destruction. The first CPT is 42800. It deals with biopsy oropharynx. And for biopsy of nasopharynx, visible lesion, simple, the CPT is 42804. And for biopsy of nasopharynx, survey for unknown primary lesion, the CPT is 42806. And for laryngoscopic biopsy, you need to refer 31510, 31535 and 31536. The next CPT is 42808. It deals with excision or destruction of lesion of pharynx, any method. The next is 42809. It deals with removal of foreign body from pharynx. The next is 42810. It deals with excision, branchial cleft cyst or vestige, confined to skin and subcutaneous tissues. The next is 42815. It deals with excision, branchial cleft cyst, vestige or fistula extending beneath the subcutaneous tissue or into pharynx. The next is 42820. It deals with tonsillectomy and adenoidectomy. Ectomy means surgical removal. Tonsillectomy is surgical removal of tonsils, and adenoidectomy is surgical removal of adenoids. For tonsillectomy and adenoidectomy younger than age 12, the CPT is 42820. And for tonsillectomy and adenoidectomy 12 years or over, the CPT is 42821. The next is tonsillectomy primary or secondary younger than age 12 years. The CPT is 42825. For tonsillectomy, it can be primary or secondary and the patient must be younger than 12 years. Then the CPT is 42825. If the patient is over 12 years of age or over, the CPT is 42826. That is tonsillectomy primary or secondary for age 12 or over, the CPT is 42826. The next is 42830. It deals with adenoidectomy primary younger than age 12 years. And if the patient is 12 years or over, for adenoidectomy primary adenoidectomy, and if the patient is 12 years or older, the CPT is 42831. Next, 42836. It deals with adenoidectomy secondary younger than age 12. And for adenoidectomy secondary age 12 or over, the CPT is 42836. The next CPT is 42842. It deals with radical resection of tonsil, tonsillar pillars and or retromolar trigone without closure. And if radical resection of tonsil is performed with closure with local flap, that CPT is 42844. And if it is done with closure with other flap, the CPT is 42845. And for closure with other flap, use appropriate number for flaps. And when combined with radical neck dissection, you can also use 38720. The next CPT is 42860. It deals with excision of tonsil tanks. The next is 42870. It deals with excision or destruction lingual tonsil, any method. And for resection of nasopharynx by bichoral and or transzygomatic approach, see 61586 and 61600. The next CPT is 42890. It deals with limited pharyngectomy. 42890 deals with limited pharyngectomy. The next CPT is 42892. It deals with resection of lateral pharyngeal wall or pyriform sinus, direct closure by advancement of lateral and posterior pharyngeal walls. And whenever this resection of lateral pharyngeal wall is performed in combination with radical neck dissection, use also 38720. The next CPT is 42894. It deals with resection of pharyngeal wall requiring closure with myocutaneous, fascicutaneous flap or flea muscle, skin or facial flap with microvascular anastomosis. Previously it is direct closure. Now it is closure with myocutaneous, fasciocutaneous flap or free muscle, skin or facial flap with microvascular anastomosis. And similarly, whenever it is combined with radical neck dissection, use 38720 also. And for limited pharyngectomy with radical neck dissection, use 38720 with 42890. And for flap used for reconstruction, you need to refer this following integumentary CPTs. Now let us see some examples. 7-year-old female presents to the same day surgery unit for a tonsillectomy. Here tonsillectomy is performed and the patient is younger than 12 years. During the surgery, the physician notices adenoids are very inflamed and must be taken out. So here both tonsillectomy and adenoidectomy are performed for a patient younger than 12 years. So the correct CPT is 42820. It deals with tonsillectomy and adenoidectomy younger than age 12 years. Next question. 12-year-old patient had an 12-year-old patient had an adenoidectomy in 2013 and a second adenoidectomy, simply secondary adenoidectomy this year. What CPT code are to be reported is or are to be reported for the second adenoidectomy performed this year? Second adenoidectomy is nothing but secondary adenoidectomy. Secondary adenoidectomy and the patient age is 12 years. So the correct CPT is 42836. Adenoidectomy secondary age 12 or over. Next, coming to repair CPTs, the first CPT is 42900. It deals with suture pharynx for wound or injury. The next is 42950. It deals with pharyngoplasty. Oplasty is nothing but surgical repair. Pharyngoplasty is the surgical repair of pharynx. It can be either plastic or reconstructive operation on pharynx. And for pharyngeal flap, use 42225. The next CPT is 42953. It deals with pharyngoesophageal repair. And for closure with myocutaneous or other flap, use appropriate number in addition. Next, finally coming to other procedures. The first CPT is 42955. It deals with pharyngostomy for fistulization of pharynx or external for feeding. The next is 42960. It deals with controlled oropharyngeal hemorrhage, primary or secondary. For example, post-tonsillectomy, simple. And for the control of oropharyngeal hemorrhage, primary or secondary, complicated, requiring hospitalization. The CPT is 42961. And for control of oropharyngeal hemorrhage, primary or secondary with secondary surgical intervention. That is, a secondary surgery is performed to control the hemorrhage. In such case, the CPT is 42962. Next is 42970. It deals with control of nasopharyngeal hemorrhage, primary or secondary. For example, post-adenoidectomy, simple, with posterior nasal packs, with or without anterior packs and or quadri. The next is 42951. It deals with control of nasopharyngeal hemorrhage, primary or secondary, complicated, requiring hospitalization. The next is 42972. It deals with control of nasopharyngeal hemorrhage, primary or secondary, with the secondary surgical intervention. 42972. The next CPT is 42975. It deals with drug-induced sleep endoscopy with dynamic evaluation of velum, pharynx, tongue base and larynx for evaluation of sleep disordered breathing, flexible diagnostic. And do not report 42975 in conjunction with 31231 unless performed for a separate condition. That is other than sleep disordered breathing and using a separate endoscope. And do not report 42975 in conjunction with 31575 and 92511. Finally, coming to last CPT in other procedures, that is 42999. It deals with unlisted procedure, pharynx, adenoids and tonsils. Now let us discuss about the next topic, that is esophagus. In esophagus, the CPTs are categorized into incision and excision. The incision CPT range is 43020 to 43045, and for excision it is 43100 to 43135. Coming to incision, for esophageal intubation with laparotomy, use 43510. There is a note here. The first CPT is 43020. It deals with esophagotomy, cervical approach with the removal of foreign body. The next is 43030. It deals with cricopharyngeal myotomy. The next CPT is 43045. It deals with esophagotomy, thoracic approach. Previously it is cervical approach. And for thoracic approach, esophagotomy, thoracic approach with removal of foreign body, the CPT is 43045. Now let us see an example. What is the CPT for the removal of foreign body from esophagus via thoracic area? That is nothing but thoracic approach. Esophagotomy, thoracic approach with removal of foreign body. CPT is 43045, which indicates esophagotomy, thoracic approach with removal of foreign body. Now coming to excision, the first CPT is 43100. 43100 deals with excision of lesion esophagus with primary repair, cervical approach. And for excision of lesion esophagus with primary repair, thoracic or abdominal approach, the CPT is 43101. And for wide excision of malignant lesion of cervical esophagus with total laryngectomy without radical neck dissection, you need to see 43107, 43116, 43124 and 31360. And for wide excision of malignant lesion of cervical esophagus with the total laryngectomy with radical neck dissection. Previously it is without, now it is with radical neck dissection. You need to refer 43107, 43116, 43124 and 31365. The next CPT is 43107. It deals with total or near total esophagectomy without thoracotomy, with pharyngogastrotomy or cervical esophagogastrotomy, pharyngogastrostomy or cervical esophagogastrostomy with or without pyloroplasty. The next CPT is 43108. It deals with total or near total esophagectomy without thoracotomy with colon interposition or small intestinal reconstruction, including intestine mobilization, preparation, and anastomosis. The next CPT is 43112. Total or near total esophagectomy with thoracotomy. Previously it is without, now it is with thoracotomy with pharyngogastrostomy or cervical esophagogastrostomy with or without pyloroplasty. The next CPT is 43113. It deals with total or near total esophagectomy with thoracotomy with colon interposition or small intestine reconstruction, including intestine mobilization, preparation, and anastomosis. The next CPT is 43116. It deals with partial esophagectomy, cervical with free intestinal graft, including microvascular anastomosis, obtaining the graft and intestinal reconstruction. And report 43116 with modifier 52 appended if intestinal or free jejunal graft with microvascular anastomosis is performed by another physician. The next note is for free jejunal graft with microvascular anastomosis performed by another physician, use 43496. The next CPT is 43117. It deals with partial esophagectomy, distal 2/3, with thoracotomy and separate abdominal incision with or without proximal gastrectomy, with thoracic esophagogastrostomy with or without pyloroplasty. The next is 43118. It deals with partial esophagectomy, distal 2/3 with thoracotomy and separate abdominal incision with colon interposition or small intestine reconstruction, including the intestinal mobilization, preparation, and anastomosis. These are partial esophagectomy CPTs. And for total esophagectomy with gastropharyngostomy, C 43107 and 43124. And for esophagogastrectomy, lower third, it is distal 2/3. For lower third and vagotomy, use 43122. The next CPT is 43121. It deals with partial esophagectomy, distal 2/3 with thoracotomy only, with or without proximal gastrectomy, with thoracic esophagogastrostomy, with or without pyeloplasty. The next is 43122. It deals with partial esophagectomy, thoracoabdominal or abdominal approach, with or without proximal gastrectomy, with esophagogastrostomy, with or without pyeloplasty. And if it is done with colon interposition or small intestine reconstruction, including intestine mobilization, preparation, and anastomosis, the CPT is 43123. The next CPT is 43124. It deals with total or partial esophagectomy with reconstruction, any approach with cervical esophagostomy. The next is 43130. It deals with diverticulectomy of hypopharynx or esophagus with or without myotomy, cervical approach. And for diverticulectomy of hypopharynx or esophagus with or without myotomy, thoracic approach, the CPT is 43135. And for endoscopic diverticulectomy of hypopharynx or cervical esophagus, use 43180. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.